At the start of every appointment, it's important that you as the practitioner and your patient are clear about what you're going to talk about. This is known as shared agenda setting, and it's an essential skill when practicing person-centred care. Shared agenda setting will work best when you are fully prepared for the appointment. Preparation might involve reading notes about past issues, problems or challenges they may have been facing and may want to discuss with you. You may already have a clear agenda of what you would like to get out of the conversation, such as how they're getting on with their exercises, or re-examining the problem. And shared agenda setting ensures both of you get your concerns addressed. The patient will have their own idea of what they would like to get out of the appointment, but neither of you will know exactly what the other's agenda is. Shared agenda setting is essential, especially if you've ever experienced that patient who wants to discuss a new problem when you're just finishing up. To avoid last-minute or rushed examinations and avoid patient disappointment, set a shared agenda first and give the patient plenty of opportunity to mention all problems before you get started. It's essential both parties explain what they would like to discuss, so you can agree the agenda. This will help maximise the time you have available during your consultation. Before negotiating a shared agenda, you still need to initiate the conversation and meet and greet your patient. Let's have a think about what we need to do to agree upon a shared agenda. You will need to start your conversation with a good open question that helps the patient open up about what has brought them in to see you. Example questions are, what would you like to discuss? What brought you in to see me today? You need to listen intently at this point, and it's really important you don't interrupt them with your agenda, thoughts on their problem, or anything else. Your only job here is to listen and take in what they are saying to you. This is fundamental to building rapport and keeping trust with your patient. Just listen and let them talk. They've usually been rehearsing their story in the waiting room, and it takes about a minute for them to tell you what's on their mind. A minute really isn't a long time, so whether your appointments are 20 minutes or 40 minutes, spending just a few minutes asking your patient about their agenda won't derail your timings. It'll actually improve them. Once you've listened to the patient's opening statement, you can repeat back to check your understanding of their agenda or clarify any points you're unsure of, and ask if there is anything else they would like to discuss. This again helps build rapport with them. You can now move on to agreeing your shared agenda. This will need to take into account the things you've read in the notes before, what the patient may not have thought about, and the time you have. Ensure you agree the priority items that need addressing in this appointment. You can always agree to set another appointment to focus on other areas at a later date. Now you can move on to the examination and treatment part of your consultation. This also gives you the opportunity to move the patient from the chair onto the treatment bench, while also discussing the details of their pain or problem, saving you time and giving you an easy flow to your appointment process. Shared agenda setting is recommended for all practitioners, and you'll find it'll streamline your appointments, making them much more efficient. Ultimately, negotiating a shared agenda is about recognising each patient is an individual and exploring their ideas, concerns and expectations to enable you to agree a plan together. Manage these expectations and you'll ensure no concern goes unaddressed.